Okay, we will explain what we've learned about gastritis. In this presentation, there will be two cases. The first, the first case is the genetic and epigenetic base of gastritis, which will be presented by myself, Asri Anggraini, and my friend Liyan. Okay, gastritis. What is this? Gastritis is inflammation of the mucosal layer of the stomach. The primary cause of gastritis is the infection with the Helicobacter pylori microaerobic gram, negative during the early phase, the elicit an acute inflammatory response eventually which evolves to long-standing chronic gastritis. In the case of gastric cancer development, chronic gastritis is the first step of the so-called multi-step cascade of gastric cancer. This sequence includes the non-chronic atrophic gastritis, multifocal atrophic gastritis, intestinal metaplasia, dysplasia, and invasive carcinoma, as were described in detail by Korea as the human models of gastric carcinogenesis.
Base of gastritis. Hypochondria risk cause B. H. pylori and important pro-inflammatory cytokine and potent inhibitor of gastritis acute secretion. It might explain the higher risk of gastric cancer development in chronic gastritis. Age is known that not all H. pylori equally associated with risk the development of gastritis cancer. For H, combination of bacterial genotype or host, the possibility of having gastric cancer, where health in those with both high risk genotypes of bacteria and the host.
Epigenetic base of gastritis. Epigenetic process control packaging and function of the human genome and contributes to the normal development and disease. Epigenetic mechanisms such as DNA methylation, histone modification, and microRNA are important even leading regulate gene expression for biological and gastrointestinal disease. In particular, DNA methylation, a process in which a methyl group 2 cytosine obtained in position 5 only if they are followed by a guanine, almost affect all parts in a mobile network such as DNA repair, cell cycle, and apoptosis. In addition, evidence suggests that aberrant DNA methylation is an early event of carcinogenesis. In addition, aberrant DNA methylation was recently considered considered as very good candidate to explain how certain environmental factors can increase the risk of cancer. Thus, the catalytic appears cancer-related genes activated by DNA hypermethylation in gastric cancer has been established, but there are some reports that make the evidence is not so strong that the author did some more experiments. The author concludes that based on the available data suggests that epigenetic manner DNA methylation may play a role in the dynamic of the development of chronic gastritis and gastric cancer per malignant cascade. DNA methylation works in both ways, deactivate or activate genes by hypermethylation or hypomethylation to modulate promoter region if of certain genes. For the next case will be presented by Etna and Silvia.
Unidentified curved bacil in the stomach of patient with gastritis and peptic ulceration. Barry J. Marshall and J. Robin Warren. Departments of Gastroenterology and Pathology, Royal Perth Hospital, Perth, Western Australia.
Okay, I will explain case 2 about gastritis. Okay, in this page, gastritis is caused by bacteria. So, someone do study to 100 of patients. Someone verifies gastroscopy to 100 patients mentioned. From research to 100 of patients about gastritis, be obtained that cause of gastritis disease is by bacteria gram-negative. From this case, it's proven that bacteria gram-negative is can be said as the main cause gastritis disease or ulcus duodenum or ulcus gastric. Okay, thank you for listening. Sorry for limited knowledge we had.